Okay, so what we have here is a CAT scan of the sinuses, and I'm making this video so that you have some idea of what we were talking about when we reviewed the CT scan with you. So what we're looking at is a CAT scan here. Make it easy for you to orient. There are the front two teeth right there. The black is air, the white is bone or teeth. Here, if we go a little bit further, there's the bridge of your nose right there. So this is the bridge of the nose, the white. And the gray is every other tissue type. So the cheeks are the same as the septum in the front, where it's cartilage, the same as your mouth, which is all just soft tissue. So, and then obviously everything's black outside of that. And what we're doing is we're cutting through the head, and we're doing that in coronal views. Coronal views are cuts like this through the head. We're cutting like this, chop, 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 okay? So this is the right side of your head. This is the right side, this is the left side. And what we're looking at here is, this is the septum, okay? So let's start off in the front of the septum, and you see in the very front of the nose, the septum is pretty straight, and these are your lips. And as we move back, you can see the septum start to bend over to this right side. So two things you see the septum bending over, and let's just focus on the septum. And you see it bend over, now it's contacting the lower turbinate. The turbinates, again, are the things that warm and humidify the air in your nose. This here, this bulge here, is the swell body. So you can see in this patient, the swell body is enlarged and it's touching the lower turbinate. And the two of them, when they're touching, block your nose. And you can see on the other side, there is some airway still, but again, it's limited by the swell body and the turbinate. Now, as we go back even further, we can see the septum coming over, and then it will go back to, there's a little spur here in this patient, so there's blocked almost completely back there, and then it goes back to midline in the back of your nose. These things are the turbinates. Let's follow those back, and you can see the turbinates here will start to compress by the deviated septum. You can see the way it's deformed, whereas this one is swollen and outward, and it goes all the way to the back of the nose. Again, these are the eyes, this is the brain, this is your skull. The sinuses are just hollow spaces in the bone. So there's hollow sinuses under the eyes, between the eyes, and over the eyes. The frontal sinuses over the eyes. The ethmoid sinuses between the eyes, and the maxillary sinuses under the eyes. And if we look real far back, the sphenoid sinus is in the back of the head, middle of the head, and behind the eyes. Okay, so when we look at the turbinates, we're looking at two things. We're looking at the size of the turbinate, but also you can see in this wall here, the sinus here is large, and the turbinate takeoff is pushed towards the middle of the nose. So that gives us two ways of making the airway open. One is by shrinking down the soft tissue of the turbinate, but also by pushing the turbinate out, or called an out fracture. We're actually giving ourselves a lot more room. And in this patient, the bulk of the room came from out fracturing the turbinate. There's also another finding here. This is called a concha bullosa. It's a hollow space in the bone where the turbinate should be thin like this one. This is the middle turbinate, but here the turbinate is wide because it's hollow in the center. And we remove the outside portion of it so that it resembles a normal turbinate, and that opens up the airway. It's like having a dilator in the airway. So a concha bullosa is actually something that's pretty useful. And that can bleed, so can this middle turbinate if we were to resect that at all. So that's pretty much all I need to show you on the CT scan. We'll have a separate video for sinuses as well. Thanks for watching.